Hi, I'm Dr. Edmond. My topic of presentation today is common health issues among Malaysian elderly and the potential barriers in accessing healthcare services. The National Health and Mobility Survey in 2018 revealed that the Malaysian elderly health is at risk from non-communicable disease such as hypertension, type 2 diabetes, chronic heart disease, obesity, and also hypercholesterolemia. Health risks and problems faced by the elderly are compounded by barriers impeding access to healthcare. Therefore, in order to better prepare for providing healthcare services to the elderly population, it is critical to determine the usage of these facilities. The issue is of mounting concern as the percentage of the elderly in Malaysia continues to increase and their life expectancy has increased by 20 years for over the past 6 decades. The rapid urbanization has caused several problems in care for the elderly in Malaysia, such as increased life expectancy, which can cause heavy burden on the healthcare system, lifestyle changes, and also the cost of healthcare services in Malaysia, which has increased dramatically. In summary, for the elder population, there is no proper healthcare screening or intervention being offered, and when they require these healthcare facilities, they face barriers of accessing and obtaining these services. My research objective was to determine the common health issues faced by the Malaysian elderly in Kuala Lumpur, and also to determine the barriers restricting access to healthcare services by the Malaysian elderly in Kuala Lumpur. In my study, cross-sectional study was used via random sampling technique. A total of 150 elderly were selected for this study and was recruited from different areas in Kuala Lumpur, such as Kajang, Ted Hill, and Bukit Jalil. Inclusion criteria include Malaysian citizen, age 55 years and above, and they are proficient in English. Ethical approval was obtained by the National Medical Research and Ethics Committee. As you can see from the data collected, the majority of the recruited participants are from age 55 to 95 years old, with female slightly more than male, and 83% of the participant was married. In this chart, we can see that both working and non-working participants are equally recruited. In this chart, most of the participants are in bottom 40 or mid 40 income group, and 34% of the participants do not have an individual income and receive financial support from family members. In the demographic factor, majority of the respondent belongs to university and college and have health insurance. Likewise, the respondents mostly were not having smoking habits. The majority of the participants' height is below 170 cm and the weight is below 70 kg. In this chart, we can see that most common health issues among this population is hypertension, followed by other chronic diseases, diabetes mellitus, osteoarthritis, obesity, respiratory disorders, cancer, and memory loss. Accordingly, more than half of the participants had visited healthcare facilities in the past 6 months, which mainly visiting the doctor and dentist. The result of the present study indicates that majority of the elderly people recruited were able to perform all daily physical activities without assistance. However, 68.9% of the participants experienced emotional problems, with 76% of the participants suffered pain while performing day-to-day activities. The data we gathered also showed that elderly people do not have good awareness about health and how to prevent illnesses. Elders felt that the costs associated with health care services is too high, while some responses can't wait too long to take appointments in public sector. And the remaining were reluctant due to the distance of healthcare centers. In conclusion, age is a demographic agent which possesses significant challenge across various aspects of life, including social, cultural, economic, familial, and society factors for the Malaysian population. The results indicate that the poor behavioral attitude towards health, along with the lack of knowledge and awareness about health-related matters, both spell trouble for the healthcare in elderly people. Better educational and preventive programs are required to bring public attention and effectively to counter problems like hypertension and diabetes in the Malaysian elderly demographic. Comprehensive training and development initiatives for healthcare services providers is imperative to foster awareness about these health-related issues and barriers to accessing services in the elderly people. In my study, the limitations are the only targeted elderly population. It includes people who are required extensive professional long-term care, such as those in nursing homes and psychiatric wards. Also, the limitations are due to language barrier, as the study only includes those who understood and were proficient in English language. The study also does not include elderly from more low-income households, and also it does not represent the entire elderly population in Malaysia, as the sample was only collected in few areas in KL. Acknowledgement, this research was funded by the Fundamental Research Grant Scheme, together with Research Excellence and Innovation Grant. The aforementioned funders did not contribute to the design, analysis, or writing of this article. These are the references. Thank you.